I would like to mention about the dental implants today. A dental implant is a material which being performed into the missing tooth region or totally edentless region to have prosthetic crowns and bridges. The implant procedure is one of the best way for prosthetic rehabilitation of edentulous region. The main purpose of the implant insert implication is to obtain effective chewing and aesthetic considerations. Initially, I do measures of bone volume in the missing tooth region in which the implant planning is made. In most of the cases, I do not use computerized tomography for the feasibility of implant insertion, just because of avoiding unnecessarily taken radiation doses. I recently used special calipers and panoramic radiographs for the bone measures in the region for implant insertion. This generally sufficient for implant insertion. Traditional implant operations requires a gingival cut through scalpel means knife. And right after that, the elevation of the gingiva and exposing of the bone then starts bleeding normally. Subsequently, implant region preparation with the drills and insertion of it, which takes longer time. Besides traditional implant operation, I recently used flapless implant surgery with laser. Under local anesthesia, gingival removal is being made with laser without bleeding within a short period of time. Then implant insertion is being made within just only 1.5 minutes. It's very good time for the implant insertion. I can tell you this short procedure, the time between like you open and close your mouth. Post-operative period is very comfortable with this technique. You may ingest your food as you wish with no pain and infection. The requirements of the antibiotics and analgesics would be decelerated with this technique. This operation technique is very good for the diabetics who has disturbed healing process of the soft tissue. This techniques also presents very good advantages of the cardiac patients who use anti-aggregant drugs. I generally perform the flapless implant surgery with laser without any cut of the medical drugs. The implant operation, which are obligation for the patient's systemic diseases, the anti-aggregant agents that I generally try to avoid to cut this kind of drugs. After the implant insertion, the patient needs to wait for healing process, which is mainly about the bone implant integration. The implant bone integration and healing requires time period up to 3 weeks and 2.5 months according to the implant quality. After this healing process, the crowns and bridges will be easily made on the implants. You may chew as you wish, like your natural teeth, and time-consuming operation is being performed with no pain. You may easily be performed your implant in your lunch interval as well. So the daily life is going on naturally without interrupting. Happy and comfortable days.